What is up, everybody? Jeremy here. And guys, I am very excited for the conversation we have today. We have Dr. Ernest Pecoraro with us today. We're going to be talking about body optimization, brain optimization, and a technology he's working with that is so powerful, it literally brought him out of retirement to help people. Dr. Pecoraro, thanks for hanging out with me today.
Oh, thanks for having me on. I really appreciate it.
So I'm interested to find out first and foremost, by training, you are a chiropractor. And for me, I have been, somebody that has gotten chiropractic treatments my entire life. It's been game changing for me as I've had a really bad sciatica from all the powerlifting I've done.
Mhm.
So for you, what made you want to, go after that career?
Well, I had wanted to be a medical doctor when I was younger or a dentist, but I was going to college, and during the summer times, I used to be a garbage man. So one day I picked up something and my neck just went out of place and I couldn't move my
Oh,
neck.
is that where you can't like turn it to the side? I hate that. That's the worst.
Yeah. So I went home for lunch, and my older brother, who is a chiropractor, he was just getting out of school, and he adjusted my neck. I fell asleep for an hour, woke up, and all the pain was gone.
Wow.
So that kind of excited me. But even more than that, I had a girlfriend at the time, and she had headaches every day. And he adjusted her, and all her headaches went away.
Wow.
So that to me was exciting because you were doing something without drugs and medicine, and you were getting to the cause of the problem.
hmm
And that just excited me to pursue that career.
It's interesting because I feel like if you look at a lot of modern medicine, that's why I'm so interested in chiropractic and functional medicine and things like that, is you're actually finding out what's happening and solving it rather than like masking all these symptoms and you're giving somebody something that's creating another problem and it's like, why don't we just fix these things, right?
Right, exactly. I've always been very excited about natural things. In fact, about a couple of years ago, I developed pancreatic cancer, which in the United States, if you're alive after 5 years, it's only 5% of the population. I
Wasn't
was,
that
re-
what Patrick Swayze passed away from?
yes, and
Okay.
also Steve Jobs. I went to a clinic in Germany, which I was referred to, and I got all natural type of treatment combined with a little bit of chemotherapy, but only like 5 to 10% of what you get in the United States. And I've been totally clear of that within 6 weeks of treatment there. So that excites me. All kinds of natural treatments excite me because the body heals itself.
Yeah. It's so interesting that too because you live what you do, and I think that's a big part of what we should be doing for a living because it makes it more of a vocation. And I'm interested to find out because you had actually a number of years ago decided that you wanted to retire, you were gonna hang it up and go relax on an island somewhere, but you decided that you know there was something new and powerful out there, and you wanted to work with it, and you actually came out of retirement to do that. So I'd love to hear about that.
Yeah, well, I had moved down to Florida. I live in New Jersey now, and I used to. And then after retiring, I moved down to Florida.
hmm
And one of my daughters was living there. And I used to come back and forth to New Jersey and Florida. And one day she was walking on the beach, and her back went out, and she just got progressively worse and worse and worse. And she was like an invalid. She was only 32 years old at the time.
Wow, that's younger than me. I just
And
turned 35.
yeah, I mean, she felt like her life was over. For 2 years, she had to lay in bed almost all day,
Oh my
and
gosh.
she couldn't walk more than 5 steps without pain. So she went to a lot of different chiropractors and acupuncturists and medical doctors, got stem cell. Uh, so, it was really hard on her, but the rest of the family, because she would call every day, everybody in the family saying how bad she felt. She thought her life was over. So she was referred to this doctor in Florida, which was about a block away from where she lives.
hmm
And he does upper cervical, like the top bone in the spine, the atlas. He just adjusts that. So she said, "Should I try that?" And I said, "Yeah, I mean, nothing else worked. You may as well." So I brought her there, and he did examination, he did x-rays, uh, he did this sound wave treatment on her atlas, and she had low back pain and sciatica. And within 15 minutes, 70% of her pain is gone. So
Wow,
to
that's
me, that
incredible.
was, yeah, that was like magic to me. I used to be a chiropractor, and I saw people like a lot of times to get them out of pain and over a bunch of months. And with one treatment, all of a sudden, a lot of her pain was gone. I mean, it doesn't always happen that way with this technique, but
Right.
um, I sent my nephew, he even had low back surgery. He was only 26 years old. The same type of thing. For a couple of years, he was bedridden. Uh, I sent him down there. He got the treatment. Now he's back surfing and lifting weights and doing everything. So uh, that excited me so much that I wanted to come out of retirement. It just so happens they were just starting this franchise of of his clinic, and I opened the first one uh, in the franchise because it's just at the beginning in New
Mm.
Jersey here.
And I'm interested to find because I'm very familiar with chiropractic because I've been adjusted my whole life. It's been a big part of my life. So how is Epic technique different? Like I guess how does it differ from I guess what we're used to for people out there listening?
Well, most of the time, people get adjusted in all different parts of their spine. For instance, if they have low back pain, they get their low back adjusted. With Epic Technique, you concentrate on the atlas, which is the top
And
bone in the
for
spine.
people that may not be familiar, could you just because some people are going to hear this, some people
Yeah,
are going to see this, if you could just kind of give us an idea of where the atlas is.
yeah, the atlas, I have a model here.
Oh, cool. For
Uh,
people watching the video, there we go. Look at
yeah,
that. That's cool.
this is the skull,
Hmm.
and the atlas is the first bone in the neck here.
Oh, cool. So it sits like right
Yeah,
underneath the base of the skull.
exactly. And there's a lot of blood vessels and nerves and everything in that area. So if the atlas moves out of place, it impinges on the nerves and the blood vessels. Now the atlas is different because it has to move in all different directions, so you can move your head all different directions. So it doesn't have the stability of the other bones in the spine, which all have discs in between, and their joints are different because they're as if you stack a bunch of chairs on top of each other. It stabilizes everything.
Sure.
So if you if you treat the atlas, it's right by the brainstem. A lot of different things can happen. For instance, the low back pain my daughter had and the sciatica was caused by the atlas being out of place. Because if it's out of place, it sends signals to the part of the brain that uh, makes your low back balance out. So if there's overstimulation on one side will be in a little bit of spasm or a lot of spasm on one side compared to the other. And the discs in the low back will then, over time, erode a little bit.
Mm. Oh, that's super interesting. So the thing that hit me, and this is kind of funny. So I drive a Volkswagen,
Hmm.
and in the Volkswagen, there's a thing that goes around the steering wheel, and it's called a clock spring. And this is the thing that allows your horn and all the other wires to go to your car, and they rotate around using the spring. It's almost like your car's atlas. It seems like to me, and that's why when that broke, my horn didn't work.
Right? Yeah, I mean,
That's
the Atlas is amazing because it has so much uh, neurology going on and blood vessels there. That's why we're getting these amazing results with it.
mm,
Um, the doctor who developed this, he actually was in other techniques similar, but he just made it better and better and better. And he invented this um, uh, instrument to adjust you with a sound wave. Usually
mm.
we move the Atlas back in place with the sound wave, and you don't even know that you got adjusted. You don't feel anything, but you feel the effects. Like people
Wow.
will You'll do it, and people will get up and say, "Is that it?" And you say, "Yeah," and they say, "Oh, I feel my blood coming to my face. I feel my pain relieving." So it's interesting.
Oh,
We
so
had
that's
this
really.
one.
I was
I'm
gonna say
sorry.
that's really interesting. I'll let you continue in a second, but I'm interested to hear like how does sound waves move that? Like how does that whole technology work? That's extremely interesting.
Well, sound waves have been used in medicine for a lot of different things. For instance, when you have kidney stones, they put sound waves to break up the kidney stones inside.
Mm.
Sometimes they use sound waves to kill cancer cells. This has been going for a long time. I mean, just you hearing me is because there's a sound wave that hits the eardrum that moves a couple of bones in your inner ear, which stimulate the nerve to allow you to hear.
Wow. So that's powerful enough to move the right bones to actually like make an effect.
Yes. And the other thing is when we have a patient come in, we do very specific x-rays. So we uh, then put an spinal engineering software to measure how the bone is out of place. And we get these coordinates because it can move in different ways. And then we input those coordinates into the adjusting instrument and aim the instrument exactly the way, if the when the sound wave comes out, we'll put it back in its proper place. And then we take a post X-ray to make sure that those coordinates are have improved.
Dr. Pecoraro, I'm really interested to find out. I guess when you're looking at this through this instrument, like like I'm sure like it's different for every person, right? Because people are different. Like, but like
Hmm.
when you're seeing this, like how far like out are these these bones that you're seeing, or is it just like minute like movements that you're actually seeing and causing an effect?
Yeah, they're very minute. I mean, in millimeters, in
Mm.
degrees, uh, very small. However, just that very
Wow.
small thing will affect the movement of the bone and impinge on the nerves and the blood vessels, things like that. For instance, we just had a woman came in yesterday, and she had a lot of such bad problems in her jaw and so painful over a bunch of years, went to a bunch of chiropractors. It just hasn't helped her. And she was like almost in tears. So she had just like a correction of like 2 millimeters. And within minutes, she felt her jaw relax
Wow.
and her bite was different. And she came in this morning again and she was feeling so much better.
Oh, that's crazy. That's super. Like, so was it like TMJ or something like that? Because like I had a problem with that many years ago, and that's why I used to get so many
Hmm.
ear infections was from TMJ. So like, regular like jaw adjustments I know were like a big deal for me. But was that like similar to what she was suffering from?
Yes, that's exactly what she was suffering from. And we've had a lot of patients come in with that. I didn't know that so many people were suffering from it. But there's actually a neurological reason for it is in the spinal cord at the level of the atlas, there's a bunch of nerves. Uh, Actually, it's like a relay center for the
Okay.
nerves. And to the trigeminal nerve, which controls a lot of the face, the hearing, and different parts of the face. And when the bones have been out of place, it will affect the muscles in the jaw, which will make your bite skewed. And so over time, chewing and doing things with your mouth, it will erode some of the structures there. So
Mm.
when we move the bone back in place, it takes the pressure off those nerves, and then healing can start, and the person feels relief.
That's wild. Because I know for me, like as I said, I had like a lot done with this, so it's not an issue for me anymore. But I used to actually feel a popping in my ear when I chewed. Um,
Hmm.
is that like similar to what you're talking about?
Yes, definitely, because you'll get that popping if the jaw is a little bit out of place, and
Mm.
by you can like keep moving the jaw into place, and some people get some relief, but by doing the Atlas adjustment, it will just relax everything, and your bite will be normal again.
So, Dr. Pecoraro, how does brain health relate to all this? Because we're talking about things that are very nerve related. When you look at it, everything kind of relays through the brain. And I guess when we're looking at it, you know, how does brain health relate to this, and what things should we be considering around that?
Uh, it's interesting because we found out that there's a bone here that comes off the temporal bone. It's called the styloid process, and it's
And
about
this is
this
the
long.
skull we're looking at again?
This is the skull, the front of the skull.
Okay.
So in like 70% of the people, this can get calcified and move down here. Uh,
Mm. So it's
and
moving
if
down past, like, for people that are listening that aren't seeing the video, it's moving down
it's
past the atlas.
Yes, right past the atlas. Now, if the atlas is rotated and on that side you have that calcified bone, in between there's the internal carotid artery, which
Hmm.
is one of the main blood supplies to the brain, and there's the internal jugular vein, which takes the waste products away from the brain. So if it's pressing on those two structures, it's going to affect the brain. It's going to not give the brain as much blood and oxygen that it needs, and it's not going to take away the waste products of brain metabolism. And also, there's a thing called cerebral spinal fluid flow, where there's fluid around the spinal cord and the brain, and it does the same thing. It feeds the brain and takes the waste products away. And it's almost like a pumping action from movement of the atlas. So if the atlas is out of place, it can you can get a buildup of that fluid in the head, causing headaches, causing a lot of brain problems. And
Mm.
this usually doesn't happen immediately, but over a long period of time, the waste products will build up there. It can cause all kinds of problems. Um, so when you get the atlas adjusted, it will normalize all those things and the brain will become healthy again. That's where we're finding with a lot of people, they're having all kinds of things like just brain fog. So people who have brain fog, that's probably what needs to be handled, along with other things like nutrition, um, exercise, which will help bringing oxygen to the brain, things like that.
From that perspective, then I'm extremely intrigued. Though this is super interesting. But I guess from that perspective, then, like, we definitely should be getting our atlas handled and things like that. But also at the
Hmm.
same time, like, there's probably some things we should be doing in our lives and also, at home and in the gym and things like that. So I guess, what should we be doing, like, dietary wise, lifestyle wise, and, like, physically wise, to help kind of, with these things happening.
Yeah, well, like with diet, it's basically you have to watch sugar, things that are very processed, things like that will impede blood flow also. Everybody knows that sugar's not good. Too much fat will clog up the arteries, so you're not getting the oxygen you need to your brain. Um, Exercise wise, people should exercise daily because that again will bring a lot of that to your brain, the blood to the brain. Other things are not sleeping on your stomach because if you're sleeping on your stomach, you have to put your head one way or the other to be able
It
to
took
breathe.
me so long to break that habit because that used to be my favorite way to sleep, and I got yelled at so many times for doing it that way.
Well, I was the same way. I used to have neck problems all the time,
Yeah.
and then when I learned I shouldn't do that way, I had to. How am I going to sleep? That's the only way I can fall asleep, and I finally broke the habit also.
So you were talking about sleep, and then I kind of derailed you. So you were saying how we're sleeping
Yeah,
is important. Is there anything else we should be looking at?
yeah. You should sleep on your side or on your back. That's one thing. The other thing is to get what's called a cervical pillow. Cervical pillow is like hollowed out in the middle, and what you want to do is have your um, head level and have your neck supported.
Mm.
Because by doing that, a lot of people have problems because over the years they sleep with a hard pillow
Hmm.
or a pillow is not supporting their neck, and that will cause the atlas to go out. And, uh, people will get up and say, I don't know, I feel foggy, I don't know why. And that's when they get up in the morning, and that's one of the reasons.
Well, Dr. Pecoraro, I've really enjoyed this conversation. I feel a lot smarter today, and I hope our audience do as well. For people listening, if they want to find out more about you, or I think you also have a special gift for them as well, if you could tell us about that.
Yes, I mean, I'm so excited about this technique and the results we've been getting and how quickly we get the results. I want to give a special gift to your audience, which would be a free consultation on the phone. So if they have any problems that they're not sure if this kind of treatment can help them, uh, they can call the office or email us and give us, we'll make a time for them to call. And we have a place they could go to. It's goepicclinic.co. Goepicclinic.co. And they can put their name and email us, and we'll call and make an appointment for them.
Very cool. Well, you guys heard that. That's goepicclinic.co. Dr. Ernest Pecoraro, thank you so much for hanging out with me today, sir.
Oh, thank you. I appreciate it.